ठीक ठीक।
सर एक बार प्लीज वो कर लेना, एडमिनिस्ट्रेशन के अलावा ये जो विजिटर है ना उसमें चले जाएंगे, स्पेशल इनवाइटेड है उसमें चले जाएंगे।
अभी तो उन्होंने आके बोला कि जो लोग बैठे हैं वो ठीक है।
वो तो बैठे हैं, वो बैठिए, उनको तो हम नहीं खा रहे, लेकिन जो वो पीछे बैठते हैं।
Om Amrita Vishwa Namaha. Sabhi ko pranam. A warm welcome to everybody. Our Honorable CM Manohar Lalji has just reached the venue. He would be coming in along with the other distinguished guests. Vijay ji.
Once I give this first thing, तब तक time है।
Anya's been wow. The Honorable CM of Haryana, please give a huge round of applause.
Om Amriteshwarya Namaha. My humble salutations and pranams to Amma, Her Holiness Mata Amritanandamayi Devi and the C20 Chair, and my greetings, namaskarams, a warm welcome to all the Honorable Chief Minister, the Honorable Ministers, and all the distinguished civil society leaders, MLAs, members of the C20 Secretariat, eminent government officials, and all the eminent personalities from across the world joining us today, here and online on this momentous occasion of the inaugural ceremony of the C20 Integrated Holistic Health Summit 2023 at the Amrita Institute of Medical Sciences at Faridabad, Haryana, India. One of the key focus areas of the G20 C20 is integrated holistic health, and this international summit is a forum to bring together grassroots CSOs, experts, practitioners to recommend best practices, foster collaboration, and create awareness around holistic approaches to health and awareness. Under the visionary leadership of Prime Minister Modi ji as the G20 chair and the universal guidance of Amma, Mata Amritanandamayi Devi, the C20 chair, this is an extraordinary opportunity given to all of us to contribute to the development of civil society for the benefit of the most in need. Actually, it is so apt that we are all gathered for this forum here. India is the mother of holistic and integrated health. With our ancient wisdom passed down from the rishis, the way of living where nature is considered an integral part of our lives. This extremely rich scientific heritage amalgamating with discoveries in modern science. And this institute, the Amrita Hospital at Faridabad, is a testament to Amma's dedication to the upliftment of mankind. In her vision of universal oneness, her desire to make quality healthcare accessible and affordable to the ones most in need, it is indeed the best place to carry out this work. As a leader in the field of medicine since 1998, Amrita Hospitals and the allied medical institutions of the Mata Amritanandamayi Mutt have provided completely free treatment to 51 lakh patients and subsidized care to another 3 lakh patients, a total of 764 crores spent in charitable medical care. On behalf of the Mata Amritanandamayi Mutt and the Amrita Hospitals, I would like to sincerely thank the Honorable Prime Minister, the Honorable Chief Minister of Haryana, central and state ministers, government officials, doctors, nursing staff, other esteemed colleagues for their immense contributions in creating and supporting this world-class hospital and medical university campus here at Faridabad in Haryana, India. Now I would like to, on behalf of the C20 Secretariat, the C20 Core Committee, the C20 International Advisory Committee, and the C20 Steering Committee, I would like to request our Honorable Chief Minister of Haryana, Shri Manohar Lal ji, and Swami Amrita Sarupananda ji, to lead all the eminent members on the dais to grace this ceremony with the lighting of the lamp on behalf of all the dignitaries, online and offline. I would now like to invite Dr. Priya Nair to invoke the divine's blessings with the prayer.
ध्यायामसु विभातभानुवदना सान्द्रावबोधात्मिका तत्त्वज्ञानविभूषितामभयदा तच्छब्दविद्योतिका मन्दस्मेरसुभाषितेर्नतिकृतां सर्वार्तिविध्वंसिकां ब्रह्मानन्दपरायणाम् अतुलिताम् अम्बामृताख्यां पराम्.
Now I request our Swami Nijanvitananda Puriji to welcome all our dignitaries. Swamiji is the Administrative Director of this magnificent Amrita Hospital at Faridabad. As a Karma Yogi, Swamiji's hard work and dedication has been instrumental in the launch and growth of this world-class healthcare campus. Swamiji.
A very warm welcome to all who are assembled here on this momentous occasion. G20, of course, is a voice of governments of so many countries. The C20, under the aegis of G20, is a voice of the people of all of these countries, a meeting of minds and a true meeting of hearts. We would like to first of all welcome our most beloved Chief Minister, Sri Manohar Lalji. He has been a constant support in all our endeavors here. In fact, from the time of the permission for the buildings, he has been directly involved in all of the activities, to laying of the foundation stone of the Amrita Hospital, to the naming of the road as Mata Amritanandamayi Marg, and now till this event, ushering in an international event into Faridabad, into this Amrita campus. The Honorable Chief Minister has been an active participant in all our activities here. I would request Dr. Sanjeev Singh, Medical Director, Amrita Hospital, Faridabad, to come up and honor the Chief Minister of Haryana. Please, a round of applause for somebody who has been a part of this organization and part of our endeavors here. Shri Krishanpal Gujjarji, the Union Minister of State for Power and Heavy Industries, who's also our local MP, is someone who devotes his time to the center, but still somehow manages to be so deeply involved in all the activities in Faridabad. He has always been just a call away. Sir, the sapling that you planted when you came for the stone laying along with the Honorable CM is now a huge shade-giving tree. Thank you for all your cooperation and help, sir. I would request Dr. Ram Manoharji, member of the organizing committee of the IHH, to welcome Shri Krishanpal Gujjarji. Colonel Dr. B.K. Mishra, Principal, Amrita School of Medicine, welcoming the Honorable Minister. Shri Pavan Jindalji, who was actually a leading industrialist, who at the peak of his growth handed over the reins of his business to others, and has fully dedicated his life to social service. Pavanji is a shining example of the Indian ethos of personal and societal upliftment. Pavan Jindalji, the Sangh Chalak of Haryana. Dr. Prem Nair, the Group Medical Director, welcoming him. Shri Ranjit Singh Ji, the Power Minister of Haryana, has been someone who has been a regular visitor to our site. From when we were in the middle of construction to now, the Honorable Minister has been with us. In fact, he has taken innovative steps to ensure that we have a steady supply of power so that the patients do not suffer. Dr. Sanjeev Singh जी, आपसे निवेदन है कि मंत्री जी का आदर सत्कार करें. Our very own Ambassador Vijay Nambiarji, who has had an illustrious career in the External Affairs Ministry of India, who was Deputy NSA in the Government of India, served as a special advisor to the UN Secretary General, has now been leading the efforts of the C20 on behalf of the chairperson, our beloved Amma, as Sherpa of the C20. I would request Colonel Dr. B.K. Mishra ji to welcome Nambiarji. Dr. Agnes Benengwaho, the former Minister of Health, Rwanda, has been someone who has been so very active in the field of defining policy for health for all. She has been a doctor, an academician, a policymaker, and a tireless proponent of many medical issues. I would request Dr. Lekha Vishwanath, Principal, Amrita School of Nursing, to honor Dr. Agnes. Shri Mulchand Sharma ji, the tireless Transport Minister of Haryana, who has allowed many buses to ply from common areas to the vicinity of our hospital. Mulchand ji, aapka swagat hai. Dr. Prem Nair, our Group Medical Director, would now honor the Honorable Minister. Dr. Adolfo Rubinstein, the former Health Minister of Argentina, is another luminary in the field of medicine. Not only has he been a policy maker, he himself has been in the field of research and has innumerable research papers in his name. I would request Dr. Ram Manohar ji to honor our distinguished guest. We have amongst us a few more distinguished guests who are here. Our local MLA Rajesh Nagarji is here, Seema Trikka ji and Narinder Gupta ji. A very warm welcome to all of you, sir. Ma'am. Swami Amrita Swarupandapuri, the Vice Chairman of Mata Amritanandamayi Devi, member of the Troika of C20, is a philosopher, able administrator, and erudite speaker and ambassador of Amma, carrying Amma's message of love and compassion to all corners of the world. Swamiji has been the guiding light for the C20, tirelessly working behind the scenes to ensure that things work seamlessly. I would request Dr. Prem Nair to take Swamiji's blessings.
We would also like to offer our formal welcome, felicitations and regards to Dr. Tedros Ghebreyesus, Director General of the World Health Organization, who has joined us online. Welcome, sir. Now I would request our distinguished C20 Sherpa, Shri Vijay Nambiarji, to give the introductory address. Shri Vijay Nambiarji was the former Special Advisor to the UN Secretary General, Mr. Ban Ki-moon. Mr. Nambiar previously served as Deputy National Security Advisor to the Government of India and the head of the National Security Council Secretariat. Besides being India's ambassador to Pakistan, China, Malaysia, Afghanistan, Algeria, Shri Nambiar also served as India's permanent representative to the United Nations in New York. Shri Vijay Nambiarji.
Let me start by seeking the blessings and beatitude of Her Holiness Mata Amritanandamayi Devi or Amma. The Honorable Chief Minister of Haryana, Sri Manohar Lal Khattar ji, Swami Amrita Swarupanand Swami ji, Mr. Krishan Pal Gujjar, Honorable State Minister, Mr. Pawan Jindal, Ranjit Singh ji, Mr. Moolchand ji, Dr. Agnes Binagwaho, former Minister of Health of Rwanda, Dr. Adolfo Rubinstein, former Minister of Health of Argentina, Dr. Manoj Nesri, Advisor, Ministry of Ayush, Government of India. Distinguished visitors who are here, distinguished guests, experts, people who have come to participate in this summit of the Working Group on Holistic Health, ladies and gentlemen. I am most honored to participate today at this session of the flagship conference or Working Group Summit of the C20 Working Group for Integrated Holistic Health. As chair of the C20, Her Holiness Mata Amritanandamayi Devi or Amma embodies the very principle and spirit of Vasudhaiva Kutumbakam. Over the years, she has championed a whole range of issues such as those of public health, protection of nature and the environment, and most of all, the inculcation of universal values of compassion, inclusiveness, and harmony amongst all beings around the world. Health has been a continuous priority in most previous C20 summits. It is not surprising that it remains all too relevant today also. The holistic health approach to wellness addresses the physical, mental, emotional, social, and spiritual components of health and recognizes that tradition, culture, community, lifestyle, and environment all contribute to health. After the ravages of the pandemic, the world has come together to clear its debris and detritus. Some of it still survives, and deal with its aftermath. Not only have health services in many countries been disrupted and progress in universal health coverage adversely affected, but new vulnerabilities are emerging and the world is having to cope with fresh challenges. The working group is therefore rightly addressing the range of issues like mental health, nutrition, women and child health and well-being, elderly care, as well as holistic health approaches, One Health, and non-communicable diseases. Mental health issues are most alarming among the youth, mainly due to the increase in substance abuse, including the addiction to electronic gadgets. You will need to give attention to this issue, as also to the various other issues that you have before you. We need, of course, to move away from silos and towards a health model that is proactive in monitoring, managing, and maintaining the health status of the community as part of a broader concept of health. An integrative approach towards health is where modern medicine, Ayurveda, yoga, and meditation are all considered together. Holistic health considers the whole person, mind, body, and spirit. At their recent meeting, the heads of the Food and Agricultural Organization, the UN Environment Programme, UNEP, the World Health Organization, and the UN-backed World Organization for Animal Health came together in the face of multiple global emergencies posed by the threats of disease spillovers between animals and humans, loss of biodiversity, and climate change. They have stressed the need to prioritize One Health approaches, to invest in building workforces with cross-sectoral skills, and to prevent health threats at the source, with close attention paid to zoonotic diseases. Their 7-point response is well known, and I shall not repeat them. Improved efficiency in healthcare delivery, extending healthcare to rural areas, and provision of good quality health at low cost, as well as the adoption of e-health initiatives, including ICT, are measures that have been undertaken by the government across the country and need to become models of emulation across other developing countries too. I'm confident that in the course of this very important summit, your working group will be able to identify important policy proposals for consideration at the C20 summit in July, and then take them forward for the G20 leaders to reflect on during their summit in September this year. I wish the conference all success. Thank you.
Thank you, sir. Thank you for your very nice introductory remarks. Our next speaker probably needs no introduction, but I will still say a few words. Amma has personally embraced, listened to, and transformed the lives of 40 million people across the world. Amma is an extraordinary visionary and humanitarian who has touched almost all areas of human life. Amma's dedication to the upliftment of mankind or humankind is rooted in her vision of humanity's essential oneness, Vasudhaiva Kutumbakam, as highlighted by India's G20 motto. Amma says, "We are not isolated like islands, but links of a common chain. Love is the string that binds us together." It is Amma's view that a truly positive transformation can be brought about in society only when people understand this truth and serve each other selflessly as a result. In Amma's own words, if we wait for others to change, we will wait forever. We should change first, and then others will follow our example. Every one of us should try to become a role model. Whether we realize it or not, someone, somewhere is looking up to us. Amma serves as the chairperson of the Mata Amritanandamayi Mutt, leading its vast array of humanitarian and institutional programs, and as the Chancellor of the Mutt's multi-campus deemed university, Amrita Vishwa Vidyapeetham. As all of us know, Amma has been appointed as the C20 Chair 2023 by the Government of India. Let us now hear Amma's message that she has specially sent for all of us gathered here at the IHH Summit.
എല്ലാവർക്കും നമസ്കാരം. ഇതൊരു ശുഭമുഹൂർത്തമാണ്. ലോകത്തിൻ്റെ മങ്ങുന്ന തേജസ് വീണ്ടെടുക്കാനുള്ള ഒരു ശ്രമത്തിന് നമ്മൾ തുടക്കം കുറിച്ച് കഴിഞ്ഞു. G20യുടെ അധ്യക്ഷത ഭാരതത്തിന് ലഭിച്ച ചരിത്രപ്രധാനമായ അവസരമാണ്. G20യുടെ ഭാഗമായ C20യുടെ പ്രവർത്തനങ്ങൾ വിജയകരമാക്കുക എന്ന വലിയ ഉത്തരവാദിത്തമാണ് ഭാരത സർക്കാരും പ്രധാനമന്ത്രി ശ്രീ നരേന്ദ്രമോദിയും നമ്മളെ ഏൽപ്പിച്ചിരിക്കുന്നു. ഈ സംരംഭത്തോട് അങ്ങേയറ്റം നീതി പുലർത്താൻ നമുക്ക് കഴിയും. ഭാരത സർക്കാരിനോടും പ്രധാനമന്ത്രിയോടും ഈ അവസരത്തിൽ അകമഴിഞ്ഞ കൃതജ്ഞത രേഖപ്പെടുത്തുന്നു. സമഗ്രമായ ആരോഗ്യപരിപാലനം, ലിംഗസമത്വം, സാങ്കേതിക ശാസ്ത്രം ഇവയൊക്കെ C20യുടെ പ്രവർത്തന പദ്ധതിയിലുണ്ടെന്ന് അമ്മ മനസ്സിലാക്കുന്നു. ഇത് പൊതുവെ മനുഷ്യൻ്റെ ആരോഗ്യത്തെക്കുറിച്ചുള്ള പലരുടെയും സങ്കല്പം ശരീരത്തിൻ്റെ തലത്തിൽ മാത്രമുണ്ട്. മനുഷ്യൻ്റെ നിലനിൽപ്പ് ശരീരത്തിൽ മാത്രം ഒതുങ്ങുന്നു. മനസ്സിൻ്റെയും ബുദ്ധിയുടെയും വികാരങ്ങളുടെയും ആരോഗ്യവും പരമപ്രധാനമാണ്. അതിലുപരി സകലനും ചൈതന്യം പകരുന്ന ഏകമായ ആത്മശക്തി അംഗീകരിക്കുകയും ഇവയെല്ലാം തുല്യമായി പരിഗണിച്ച് പരിപാലിക്കുമ്പോഴാണ് ആരോഗ്യ സംരക്ഷണത്തിൻ്റെ അർത്ഥം പൂർണ്ണമാകുന്നത്. ആധുനിക വൈദ്യശാസ്ത്രത്തിനും ചികിത്സാ സമ്പ്രദായങ്ങൾക്കും തീർച്ചയായും അതിൻ്റെതായ സ്ഥാനവും പ്രാധാന്യവുമുണ്ട്. പക്ഷെ രോഗം വരുമ്പോൾ മാത്രം ചികിത്സ തേടുന്നതിലല്ല ശരിയായ ആരോഗ്യ സംരക്ഷണം. യഥാർത്ഥത്തിൽ പ്രകൃതിയാണ് നമ്മുടെ ഒറ്റ മിത്രം. കാരണം നമ്മൾ പ്രകൃതി തന്നെയാണ്. അതുകൊണ്ട് ആരോഗ്യ സംരക്ഷണം പൂർണ്ണമാകുവാൻ പ്രകൃതിയുമായി സുരചേർന്ന് നീങ്ങേണ്ടത് ഏറ്റവും പ്രധാനമാണ്. ഇപ്പോൾ നമ്മൾ തന്നെ ആളുകൾ വേസ്റ്റ് ഇടുന്നിടത്ത് മണ്ണെടുത്ത് നോക്കി മൊത്തം പോയ സമയത്ത് അവിടെ വൃക്ഷം നട്ട് വളർത്തും. അതൊരു 3 വർഷം കഴിഞ്ഞപ്പോൾ ആ മണ്ണെടുത്ത് റിസർച്ച് ചെയ്തപ്പോൾ വിഷമേയില്ല. ആ വേരെത്ര വിഷം പിടിച്ചെടുത്തു. ഇലകൾ നമ്മൾ കാർബണത്തെ എടുത്ത് നമുക്ക് നല്ല ശുദ്ധമായി തരും. വൃക്ഷത്തെ ഈശ്വരനെപ്പോലെ ആരാധിച്ചിരുന്ന പഴയ ആൾക്കാർ. നമ്മളൊക്കെ ഒരു വൃക്ഷം വെട്ടുമ്പം പൂജിച്ച് മാപ്പ് വെച്ചിട്ട് വെട്ടിയിട്ടുണ്ട്. അങ്ങനെ ഓരോ ജീവജാലങ്ങളെയും അന്ന് നമ്മൾ ആരാധിച്ചത് തന്നിലുള്ള നന്ദി കാണിച്ചതാണ്. അപ്പം നമ്മളതൊരു പ്രാകൃതമല്ലാത്ത പ്രായോഗികമായിരുന്നു. അവിടത്തേക്ക് നമ്മൾ തിരിച്ച് കുറച്ചെങ്കിലും പോയേ പറ്റുള്ളൂ. പണ്ട് നമ്മൾ ഗ്രാമത്തിൽ എൻ്റെ കുഞ്ഞിൽ 60 വർഷം മുമ്പ് കൈക്കൊരു മുറിവെല്ലാം പറ്റിയാൽ നമ്മൾ ചാണകം എടുത്ത് വെച്ചാണ് മുറിവ് പൊറുക്കും. ഇന്നത്തെ പശുക്കളുടെ ചാണകം തട്ടിയ സെപ്റ്റിക്കാവും. ഒരു കാര്യം വ്യക്തമാണ്, ഇന്ന് മാനവരാശി നേരിട്ടുകൊണ്ടിരിക്കുന്നതും സംഭവിക്കാനിരിക്കുന്നതുമായ അനർത്ഥങ്ങൾക്ക് ശാശ്വതമായ പരിഹാരം ഉണ്ടാകണമെങ്കിൽ മനുഷ്യനവൻ്റെ ആന്തരികമായ കാലാവസ്ഥയ്ക്ക് കൂടി മാറ്റം വരുത്താൻ തയ്യാറാണ്. കാരണം ബാഹ്യമായി സംഭവിക്കുന്ന ആഗോളതാപനവും കാലാവസ്ഥ വ്യതിയാനവും മനുഷ്യൻ അവൻ്റെ മനസ്സിൽ സൃഷ്ടിക്കുന്ന ദുഷിച്ച കാലാവസ്ഥയുടെ പ്രതിഫലനമാണ്. നമുക്കെല്ലാം ഒരേ മനസ്സോടെ ഒരേ ലക്ഷ്യത്തോടെ ലോക നന്മയ്ക്ക് വേണ്ടി നിസ്വാർത്ഥമായി പ്രവർത്തിക്കാൻ നമുക്ക് കഴിയട്ടെ. നമ്മളെ പിന്തുടർന്നു വരുന്നവർക്ക് നമ്മുടെ പ്രവർത്തനങ്ങൾ ശ്രേഷ്ഠമായ ഒരു മാതൃകയായി തീരട്ടെ. നമ്മുടെ ജീവിത വൃക്ഷം സ്നേഹമാകുന്ന മണ്ണിൽ ഉറച്ചു നിൽക്കട്ടെ. സൽക്കർമ്മങ്ങളാകട്ടെ അതിലെ ഇലകൾ, അനുകമ്പാപൂർണമായ വാക്കാകട്ടെ അതിലെ പുഷ്പങ്ങൾ, ശാന്തിയാകട്ടെ അതിലെ ഫലങ്ങൾ. സ്നേഹത്തിൽ ഒന്നായി തീർന്ന് ഒരു കുടുംബമായി ലോകം വളർന്ന് വികസിക്കട്ടെ. വസുദൈവ കുടുംബവും എന്ന ഈ വാക്ക് പ്രാവർത്തികമാക്കി എല്ലാവരും ഉണർന്ന് ഫലവത്താക്കാനും നമുക്ക് കഴിയട്ടെ. അങ്ങനെ ശാന്തിയും സമാധാനവും കളിയാടുന്ന ഒരു ലോകം നമുക്കെല്ലാം സായത്തമാകട്ടെ. ഈ കൃപ നമ്മളെ അനുഗ്രഹിക്കട്ടെ.
With Amma's blessings, we can all change our internal climate and move forward and be of service to society.
I would now like to invite our Honorable Chief Minister of Haryana, Shri Manohar Lal Khattar ji, to formally inaugurate the Amrita School of Medicine at this Faridabad campus. Sir, आपने पहले काफ़ी साल पहले अस्पताल की नींव डाली थी और आप आज मेडिकल कॉलेज का भी उद्घाटन आपके शुभकामनाओं में कर कमलों से होगा। हर्ष की बात है। डॉक्टर V.K. मिश्रा, प्रिंसिपल, Amrita School of Medicine. We would now like to invite Manohar Lal ji to give the inaugural address at this Integrated Holistic Health Summit, C20 India 2023.
प्रधानमंत्री जी, समाज सेवी विश्व उद्योगपति श्री पवन जिंदल जी, माननीय केंद्रीय बिजली एवं हरित उद्योग राज्य मंत्री श्री कृष्णपाल गुर्जर जी, हमारे हरियाणा सरकार के विद्युत मंत्री श्री रणजीत सिंह जी चौटाला,
Your Excellency, which I
परिवहन मंत्री श्री मूर्ति शर्मा, हमारे इस क्षेत्र से विधायक हैं श्री राजेश नागर जी, विधायक बहन श्रीमती सीमा त्रिखा जी, विधायक श्री नरेंद्र गुप्ता जी, स्वामी निजानंद नंदपुरी एडमिनिस्ट्रेटिव डायरेक्टर हॉस्पिटल डॉक्टर विजय।
रहती हैं, शिक्षा है, स्वास्थ्य है, सुरक्षा है, स्वावलंबन है और स्वाभिमान है। ऐसे 5 S इसमें कुल मिलाकर पूरे जीवन की गतिविधियां सिटीजन की, किसी भी नागरिक की, इसके ऊपर निर्भर करती हैं कि ये सेवाएं उसको कैसी मिल रही हैं। उसी में से उसका संतुष्टि का भाव ये बढ़ता है। यानी अगर किसी का हैप्पीनेस इंडेक्स की जानकारी लेनी हो तो इन 5 चीज़ों पर निर्भर करती है। हमारे देश में अभी ऐसी व्यवस्था नहीं बनी है। हम तो केवल इंडेक्स की जब चर्चा करते हैं तो कहीं प्राइस इंडेक्स है, कहीं किसी एक आध और चीज़ का, कहीं शेयर मार्केट का इंडेक्स वो देखा जाता है। तो ऐसे इंडेक्स में एक देश भूटान ऐसा देश है जो अपने नागरिकों का हैप्पीनेस इंडेक्स इसको मेजर करता है, उसके पैरामीटर बना रखे उन्होंने। तो मैं समझता हूँ ये सब चीज़ों का लाभ अगर लोगों को मिल जाए तो हैप्पीनेस इंडेक्स निश्चित रूप से बढ़ेगा। जैसे हम इंडस्ट्री में ईज़ ऑफ डूइंग की बात करते हैं, ऐसे ईज़ ऑफ लिविंग के नाते से इन चीज़ों पर ध्यान बहुत आवश्यक है। आज चर्चा केवल स्वास्थ्य को लेकर के है, तो जो स्वास्थ्य को लेकर के है उसमें शरीर का स्वास्थ्य, मन का स्वास्थ्य, तो ये सारी चीज़ें यानी साइमल्टेनियसली चलती हैं कि हमारा जहाँ शरीर स्वस्थ है वहाँ मन स्वस्थ है कि नहीं है। तो जब शरीर के स्वस्थ होने की बात करते हैं तो शरीर में बहुत प्रकार की बीमारियाँ ये जब घर करती हैं, उसका इलाज इसी को शायद हम स्वस्थ शरीर का एक लक्षण मान लेते हैं। लेकिन मित्रों, इससे आगे बढ़कर विचार करना होगा। बीमारी को दूर करना वो स्वस्थ होना इसको कहा जाएगा, लेकिन स्वस्थ होने से पहले स्वस्थ रहना ये बहुत आवश्यक है। अगर हम स्वस्थ रहने की तरफ चल पड़ेंगे तो फिर बहुत सी चीज़ें हमको इसके अतिरिक्त भी करनी पड़ेंगी। जब तक हम बीमार नहीं हो तब तक इंतज़ार नहीं करना, बल्कि जैसा कहा जाता है यानी प्रिकॉशन इज द बेटर वे टू ले, प्रिकॉशन इज बेटर देन क्योर। जो प्रिवेंशन इज बेटर देन क्योर, तो जब इलाज की नौबत ना आए उससे पहले हमको क्या करना है। तो हमारे यहाँ अब ये ठीक है, एलोपैथी का एक युग चल रहा है, एलोपैथी में इलाज पर ही पूरा विश्वास है। एलोपैथी ने बहुत तरक्की की है, बहुत बेहतरी की है, और हम एलोपैथी के आभारी भी हैं कि आज के युग की बीमारियों का इलाज नई नई रिसर्च करके एलोपैथी ने निकाला है। लेकिन फिर वही वो हमको एक प्रकार से बीमारियों से इलाज करके स्वस्थ होने की ओर हमारा लाभ पहुंचाते हैं। लेकिन स्वस्थ रहने की ओर इसमें जो हमारी प्राचीन पद्धति वो है आयुर्वेद, और उसको अगर बहुत विस्तार से करें वो है आयुष। नॉट ओनली आयुर्वेद बल्कि उसमें नए आयाम भी जुड़े हुए हैं। उसके अंदर आयुर्वेद है, योगा है, उसके अंदर यूनानी पद्धति है, उसमें सिद्धा पद्धति है, उसमें होम्योपैथी है, कई सारे उसके सिस्टम हैं। इन सब को भी हमको डेवलप करना पड़ेगा ताकि हम बीमार हो ही ना। हमारी सरकारों का बजट, हेल्थ का जो बजट है वो इलाज करने की ओर तो बढ़ रहा है, लेकिन स्वस्थ रहने के लिए जितने आयाम खड़े करने चाहिए उधर हमारा ध्यान कम है। बहुत लंबा विषय न करते हुए मैं तो इतनी बात कहूँगा कि हमने हरियाणा में इस ओर ध्यान करना शुरू किया है। जैसे पहले तो योगा है। अब प्रधानमंत्री जी का मैं आभार प्रकट करता हूँ कि उन्होंने जब 2014 में यूएनओ में योग को अंतर्राष्ट्रीय स्तर के ऊपर ख्याति दिलाई। 21 जून को अंतर्राष्ट्रीय योग दिवस, ये अगर किसी की इनिशिएटिव से अगर दुनिया ने स्वीकार किया तो 170 देशों ने इसको उस विषय से ऊपर, बहुत लोग तो पहले मानते रहे होंगे कि ये तो केवल एक संतों का, साधु सन्यासियों का, आश्रम में बैठे लोग, उन्हीं की क्रिया होती है शरीर की, वही योग करते हैं। बड़े बड़े योगी हुए हैं, उन योग की सुविधा को लंबे समय तक लेकर के चलने वाले उन्हीं को श्रेय जाता है। लेकिन इस योग को सामान्य जन की जीवन पद्धति में लाने के लिए अंतर्राष्ट्रीय योग दिवस, और उसके बाद भी बहुत ऐसे सन्यासी हैं, योगी, ऐसे महापुरुष हैं जिन्होंने इसको व्यक्ति के, सामान्य व्यक्ति के जीवन में लाकर खड़ा किया है। अगर उसमें बहुत नाम लिए जा सकते हैं, बहुत संस्थान लिए जा सकते हैं। इस उत्तर भारत के क्षेत्र के अंदर मैं नाम लूं तो बाबा रामदेव ने उस योग को घर घर में पहुंचा दिया। प्रातःकाल हजारों की संख्या में लोगों को बाहर निकाला, घर से बाहर। ऐसे ही हमारी संघ की जो शाखाएं हैं उसमें भी लाखों लोग बाहर निकल करके प्रातःकाल योग करने का अभ्यास करते हैं। तो शरीर के साथ योग को जोड़ना, और योग केवल शारीरिक व्यायाम ही नहीं है, केवल आसन ही नहीं है, इसके साथ मन भी सधता है, ध्यान भी है योग में। तो योग की प्रक्रिया के माध्यम से हम शरीर को स्वस्थ करते हैं, मन को स्वस्थ करते हैं, हम अपने तनाव को दूर करते हैं। जहाँ तक आयुर्वेद की बात है, हमने उसको भी आगे बढ़ाने के लिए कई कदम उठाए हैं। हरियाणा में एक कॉलेज आयुर्वेद का हमारा बहुत पहले शुरू हुआ, श्री कृष्ण आयुर्वेद कॉलेज कुरुक्षेत्र के अंदर। जब ध्यान में आया कि इसको विस्तार करना तो उस कॉलेज को हमने यूनिवर्सिटी बनाया। श्री कृष्ण आयुर्वेद हमारा विश्वविद्यालय ये कुरुक्षेत्र में स्थापित हुआ है। ऐसे ही भारत सरकार ने एक अखिल भारतीय आयुर्वेद का संस्थान NAI ये कुरुक्षेत्र में स्थापित करने के लिए 250 करोड़ रुपया लगा करके उस काम को भी हमने शुरू करा दिया है। एम्स जिसको कहना चाहिए, आयुर्वेद का एम्स। तो ऐसी बहुत सी पद्धतियाँ हमने इस स्तर पर शुरू की हैं, इलाज के नाते कहें या उसमें प्रिकॉशनरी कहें। अब ये गांव-गांव में कैसे फैले, हमने हर गांव में ऐसा एक योजना बनाई कि 2 एकड़ जमीन के ऊपर पार्क कम व्यायामशाला, जिसमें एक योग संस्थान बने, और योग संस्थान के साथ साथ एक आयुर्वेद के ऊपर निर्भर वेलनेस सेंटर। अब वेलनेस सेंटर्स की भी आवश्यकता क्यों पड़ती है कि आदमी को जागरूक करने के लिए बहुत सी चीज़ें उसको बतानी पड़ती हैं। रहन सहन कैसा हो, खान पान कैसा हो, खान पान के कारण से भी हमारे शरीर में बीमारियां खूब आ रही हैं। अगर हमने अपने खान पान को इस नाते से सुधार लिया कि आहार ही औषधि है, अभी तो पिछले काल में ऐसा कुछ क्रम चला, हमारा आधार ही हमारी बीमारी का कारण बन गया। देश में अन्न की कमी हुई 60s में, एक रेवोल्यूशन आया, ग्रीन रेवोल्यूशन, हरित क्रांति, अन्न बढ़ाया जाए। अन्न बढ़ाने के लिए विभिन्न पद्धतियां उपयोग की गई कि उसमें केमिकल जो खाद है वो डाले गए, पेस्टिसाइड्स डाले गए, और उस केमिकल मैन्योर और पेस्टिसाइड्स के कारण से उसकी जो गुणवत्ता है, अन्न तो बढ़ गया, बहुत बढ़ गया, हम आत्मनिर्भर बन गए, लेकिन अन्न की गुणवत्ता खराब हुई। वो अन्न जब हमने खाया तो हमारे शरीर में कैंसर जैसी बीमारियां, ब्लड प्रेशर जैसी बीमारियां, डायबिटीज जैसी बीमारियां, इसका लेवल बढ़ गया। बहुत लोग कैंसर से पीड़ित हैं। खराब इस एक प्रकार से ज़मीन में से जो केमिकल्स के कारण से अन्न खराब हुआ, पानी खराब हुआ, उसका उपयोग करने से। अगर हमने प्राकृतिक पद्धति से, ट्रेडिशनल सिस्टम से, अपने जो प्राकृतिक खेती होती है, ऑर्गेनिक खेती होती है, इस ओर बढ़ करके अगर हम अन्न पैदा करेंगे और उस अन्न को खाएंगे तो फिर अन्न ही औषधि का काम करेगा, अन्न औषधि का काम करेगा। और अन्न को भी खाने के लिए हमें कुछ जो सलाहकार हैं खान पान के, जिसको डाइटिशियन कहते हैं, इसकी व्यवस्था हम कर रहे हैं सारे हरियाणा में। गांव के आदमी को भी बताया जाए कि क्या खाना क्या नहीं खाना, शरीर के हिसाब से खान पान होना चाहिए। एक कहावत है ना कि खाना चाहिए जो मितकर हो, रितकर हो और हितकर हो, यानी ऋतु के अनुसार खाना बहुत आवश्यक है। अभी तो क्या है, खाने पीने के सिस्टम सब टूट गए, कब किस समय खा लेते हैं, टाइमिंग ही नहीं है, कौन से मौसम में क्या खाना चाहिए क्या नहीं खाना चाहिए। आजकल प्रिजर्वेशन के नए नए तरीके आ गए हैं, कोल्ड स्टोरेज हो गए हैं, तो ऋतु के हिसाब से खाने पीने का जो सिस्टम होता था वो भी प्राचीन पद्धति के अनुसार हमको आना पड़ेगा। वर्ष में 2 बार हम देखते हैं नवरात्रे आते हैं, और नवरात्र में बहुत लोग ऐसे होते हैं जो खाने पीने की एक मौसम की चीज़ को दूसरे मौसम में जाने से पहले बीच में गैप देते हैं और 8-8 दिन 10 दिन का व्रत रखते हैं, शरीर को उसके अनुकूल बनाने के लिए, ताकि पहले जो खाना पीना था वो एक अलग सिस्टम में था, अब उसकी सफाई की जाए ताकि अगले खाने पीने के सिस्टम में एक 8 दिन का बीच में गैप डाला जाए। व्रत का कोई ऐसा धार्मिक बहुत बड़ा महत्व ऐसा मुझे नहीं लगता। हम अपने स्वास्थ्य को कैसे ठीक रखें, ये एक हमारे जीवनचर्या का हिस्सा था। बहुत लोग भूल गए, आज भी करते हैं। और मैं आपको एक हैरानी की बात बताता हूँ, अपने प्रधानमंत्री नरेंद्र मोदी जी 9 नवरात्रे जो पहले काल में आते हैं अप्रैल में, जब नया अनाज आता है उससे पहले पुराना अनाज तो समाप्ति पर होता है, तो बीच में 9 दिन का, ऐसे ही 9 दिन के अगले जो नवरात्रे होते हैं दशहरे से पहले 9 दिन कुछ नहीं खाना, केवल पानी पर रहना, केवल पानी पर रहता वो व्यक्ति 9 दिन। हम तो हैरान हो जाते हैं कि अपने शरीर को मेंटेन करने के लिए 9 दिन केवल पानी पर रहना किसी योगी का ही काम हो सकता समझ।
And decisions and implementations are rapid because you become oriented on action rather than the result. You become action oriented, not result oriented. The tsunami was sudden. In the twinkling of an eye, in a few minutes, few moments, giant-sized waves rose up, swallowing houses and innocent people. All that they had, all their savings, their children and women, parents, elderly people. Within a moment's time, everything there disappeared into oblivion. Amma immediately stopped seeing people. Amma was giving darshan. She immediately stopped seeing people and initiated the evacuation process. She came down and waded through the flood waters, giving instructions to thousands of people, including the residents and the villagers who came running to our NGO headquarters, hoping to find a safe haven. It was a scene of all-consuming panic, like Pralayagni, the fire of disillusion, utter confusion, mothers with babies, small boys, girls looking for their parents, the elderly, sick, disabled. It seemed overwhelming and unmanageable. Another wave could have appeared and swallowed everything. However, Amma's focus was not on fear, but on love and compassion. So my point is, not just in the field of medicine, any area of life will be incomplete, disintegrated, opposite to integration, and will not produce the result we desire if the most important ingredient, factor of love and compassion are absent. My humble suggestion to all experts, to anyone and everyone working in any area of life, is to practice listening. Listening from the heart, not from here. Just sincere listening alone can bring about a change, a transformation in the other. Learn to listen with your heart. It will open the wellspring of your inner potential, the infinite power of love within, which in turn will tremendously help the other patient. The other person, if it is a patient or whoever it is. Right listening with the right attitude at the right time makes everything simpler. Yesterday I was listening to a panel discussion on suicide. How suicide is becoming so prevalent in the younger generation. The first set of people who notice the change in the youngster is the family. Not an outsider, not the friend, the parents. If they are with their children, they can notice because they know their child better than anyone in this world. So if they listen, if they are watchful, if they are alert, they can see the changes and do things at the right time. That makes things simpler. A couple of years ago, in the middle of the pandemic, we were at a UNESCO meeting in Barcelona. Hundreds of people registered. At least, maybe 800 people. But I felt so sad seeing the poor attendance inside the main hall, especially during the afternoon hours. There were people, delegates, and registrants everywhere, but outside the hall. There was no one to listen. Just like the famous poem by Samuel Taylor Coleridge, water, water everywhere and not a drop to drink. Later, I was introduced to the then director of UNESCO. I couldn't help asking him, "Sir, can't you make things simpler or more understandable than making everything sound so complex and technical?" I'm sure more people will understand and the attendance will also be more. So listening is one of the simplest things we can do, and the benefits are miraculous. That is yet another lesson one can learn from Amma. She is the greatest listener in the world. Amma's extraordinary ability to listen to all sorts of people and her amazing capacity to interact with people from all walks of life, from all over the world, is legendary. No matter how big the crowd is. Even if Amma will have to sit 22 hours, 26 hours, no problem. With a smile, with the same love, Amma will embrace every single person regardless of gender, age, status, or physical condition. She patiently listens to those who pour their hearts out to her, and each of these sessions lasts until she sees the last person in line, and this has been happening for the last 50 years without taking a single break. So this cycle of love and listening creates a virtuous circle, thereby blocking the possibility of being drawn into the whirlpool of a vicious circle. Life is a perfect combination of logic and mystery, perhaps more mysterious than logical. In all areas of life, the head and heart should go together. People tend to depend solely on intellect and logic alone to unfold life. Logic definitely has its own place, but so does the unknown. We definitely need rules, system, and order, hierarchy, organizational structure to control our day-to-day activities, but we should also understand that life is not entirely calculative or mathematical. So everyone, regardless of their area of work, especially doctors and scientists, if they find some time to do spiritual practices and meditation, that will help them to tap into their intuitive mind. The mind, or even the subconscious mind, cannot help. The intellect cannot help, but the intuitive mind can help. And that's what our ancient Ayurvedic physicians had. I know Ayurvedic physicians who would explain all the symptoms of a disease just by feeling the pulse, nothing else, or just by observing your lower eyelid. They were all upasaks, very great meditators. So mixing a little bit of meditation with medicine and meditation will bring about a qualitative shift and transformation, both in them as well as in the patients. In fact, both the patient and doctor require tremendous spiritual patience. Both the doctor and the patient. So proper integration is almost impossible without finding the silent meditative spot within us. So if the G20 countries, which constitutes of almost all the developed countries and developing countries, if they become ambassadors of, instead of G, if we can rename it, Group 20, G stands for group. If we can slightly modify it and say goodness 20. If all G countries become ambassadors of goodness, then even the developing and the underdeveloped countries will benefit. There will be no problems in the world. The underdeveloped and developing countries will also develop. So then instead of G20, we will have GC20, that is Goodness Civil 20, GT20, Goodness Technology 20, GW20, Goodness Women 20, GY20, Goodness Youth 20, so on and so forth. All will be good, and goodness will pervade everywhere. So for that, meditation and medication. Medication and meditation should go hand in hand. Proper integration is almost impossible without finding the silent meditative spot within you. And yoga is also meditation. It is not just a physical exercise. So let us try. Just an experiment. Meditate. Do yoga. And see what happens. Listen to people. Be compassionate. And that brings the right combination, integration. Thank you so much. Thank you for this wonderful opportunity.
Thank you, Swamiji, for your wonderful words, inspiring words. I would also like to mention now, sorry for that, our Honorable Health and Home Minister, Anil Vijji, had come up till Faridabad. He's in Faridabad right now to attend the program. But because of some health problems, he could not come here and attend the program. So he has sent his regrets and his best wishes for the program. This auditorium that we are sitting in is, I think, maybe one of a kind in Delhi NCR. And though we are already sitting in it, the program has been started. But the fact is that there has been no formal inauguration of the auditorium. And such a thing of beauty, of splendor, requires that formal inauguration. It has 1,300 seating capacity and has all the facilities which are necessary for hosting any sort of programs. So we would now request our Krishanpal Gujjarji to formally inaugurate the auditorium. I would request Sanjeev Singh ji, our medical director, to hand over the remote to Shri Krishanpal Gujjarji, the Union Minister of State of Power and Heavy Industries, to formally inaugurate the auditorium. Thank you, sir. Thank you. The Disha platform, the digital Shiksha for advanced clinical capacity building is, before that, Krishan Palji, would you grace us with a few words? Thank you. मुझे लगा कि शायद आपने पहले ही सूचित किया था कि जब चीफ मिनिस्टर जी हैं वही बोलेंगे, परंतु तब भी मुझे लगा कि एक बार पूछ लेना चाहिए आपसे. धन्यवाद सर, धन्यवाद. Disha platform, the digital Shiksha for advanced clinical capacity building, is India's first case-based simulation learning platform for critical care in public health. USAID funded and Jupai implemented Disha is developed in collaboration with Amrita Vishwa Vidyapeetham and Amrita hospitals and aims to skill over 1 lakh healthcare professionals in rural areas. We acknowledge the presence of USAID representative Dr. Ruben Swamikan, Division Chief of the Tuberculosis and Infectious Diseases. The Disha platform is launched as a C20 initiative inspired by Sri Mata Amritanandamayi Devi's vision of compassionate healthcare. We would like to invite Sri Ranjit Singh ji to formally inaugurate and release this app. Dr. Prema Nedungadi, Director, Amrita Create and Chair, School of Computing, to hand over the remote to Ranjit Singh ji.
बीमारी एक निराशाजनक दुख की स्थिति बना देती है, इसलिए सबसे ज्यादा हमारी सेवाओं और स्नेहपूर्ण देखभाल की जरूरत बीमार लोगों को है. ऐसे बीमार लोगों का एकमात्र आश्रय स्थान हॉस्पिटल रह जाता है. जहां तक रोगी की बात है, उसके लिए डॉक्टर प्रत्यक्ष भगवान होता है, क्योंकि उसे पीड़ा से थोड़ा आराम देने वाला डॉक्टर ही तो है.
बहुत बहुत धन्यवाद. आपकी जानकारी के लिए डॉक्टर प्रेमा और उनके टीम द्वारा ये जो विकसित किया गया है ऐप, ग्रामीण इलाकों में जब वहाँ स्वास्थ्य सेवी जो हैं, जब उन्हें विकट परिस्थितियों में पेशेंट्स जब आते हैं, उनके सही प्रकार से कैसे उनका इलाज किया जाए and how to handle those situations. All sorts of teaching is available in this app, and that is what makes it very unique and very, very useful. सरकार की ओर से भी एक पहल की गई है कि वो इस ऐप को लेकर जहां तक पहुंच सके एक एक गांवों में पहुंचाने की एक पहल has been taken up by the central government too. India has one of the highest rates of mental illness globally, affecting an estimated 197 million people. But many people are undiagnosed and untreated, and mental health is still considered a taboo topic. To help people with mental health conditions get the support they need, Amrita Hospitals has created a unique web portal named We Are With You. This portal provides informative content like videos, articles, testimonials, contact details for public and private mental health organizations, helpline numbers, discussion forums, and blogs in English and major regional languages. I would now request Dr. Prem Nair, Director, Amrita Hospitals, to go up to Pawan Jindal ji. Pawan Jindal ji, आपसे अनुरोध है कि इस ऐप का विमोचन करें. बहुत से लोगों को इससे धन्यवाद पवन जी.
Thank you so much. I would like to mention that we are also joined today on the dais by Dr. Manoj Nesri, the advisor to the Government of India at the Ministry of Ayush. A warm welcome, sir, and I would request Dr. Ram Manohar from the committee team to please felicitate Dr. Nesri. Thank you, sir. Aapka bahut swagat. Now I'd like to invite Dr. Agnes Binwaho, the former Minister of Health, Rwanda. Dr. Agnes Binwaho is the former Vice Chancellor of the University of Global Health Equity, an initiative of Partners in Health, which focuses on optimizing the delivery of healthcare around the world by training global health professionals who strive to provide more equitable, quality health services for all. Dr. Binwaho founded the Rwandan Pediatric Society, chairing it till 2019. She was also named among the 100 most influential African women for 2020 and 2021. Ma'am, over to you.
Thank you for this kind introduction, and thank you for having me here. I feel very, very honored to be with all of you today for this, this event and also what it means globally. What we are doing here is very important, and I'm happy. First, as a woman here, raise your hands. We are doing so much unrecognized care, and we have to talk about that. Also, we are doing a lot in education, and I'm very proud of that. But also, I have to recognize that we could not achieve, even as women, if we don't have great men that work with us and accompany us. This conference is important because integrated holistic care is not really taking care. We are all in our silo. I'm an epidemiologist. Data are important, but the people are behind the data. I'm a clinician for adults. But before being an adult, they are kids. And many diseases they face when they are adults, they have acquired them or the susceptibility when they are kids. So holistic care is absolutely important. And thank you for having me here. Thank you to be here to discuss that, because it's not about my country, Rwanda, I'm very proud of. I just want to say that we have controlled COVID. We have controlled HIV. We have one of the best life expectancy in Africa, just because we have integrated care in our policies and law, but also integrated approach targeting the most vulnerable, because those 20% of the population everywhere, in rich countries, the vulnerable, we consider them as lucky people, but they are not. Look how many people died in Europe with COVID and in America. So, Systems are important. We all have to learn from each other. Some poor countries have a lot to teach to those rich countries. We wonder what rich means when your people die. So we are here to learn. I'm here to learn a lot with all of you, but also to exchange. Thank you for having me. I'm very proud to be here.
Thank you so much, Dr. Agnes, and we really look forward to working with you. I'd now like to invite Dr. Adolfo Rubinstein, the former Minister of Health, Argentina, and the founding director of the Argentina Center for Implementation and Innovation in Health Policies. Dr. Rubinstein is also a professor of public health and family medicine at the University of Buenos Aires and a visiting professor at Harvard. A recipient of numerous Fogarty and NIH grants, Dr. Rubinstein has published more than 120 papers. His research focus on the epidemiology and implementation of preventive interventions to control non-communicable diseases and the evaluation of health programs and policies. Sir, over to you.
Good morning. Namaste. I'm very honored to be here, and thanks for inviting me. I'm honored to be here today in the company of such esteemed leaders of civil society organizations committed to global health. Civil society plays a critical role in ensuring global health equity. With the rise of globalization, particularly of the COVID-19 pandemic, it is increasingly important to recognize that health issues are not just local or national, but are global. Therefore, global health equity must be addressed through collective actions and partnerships across borders and sectors. Why? Because one of the most significant contributions of civil society is its ability to hold governments and other influential actors to be accountable. They have the power to speak out against policies or actions that perpetuate health inequalities and advocate for policies that reduce health disparities. In the last couple of years, the contribution of civil society organizations were essential to mitigate the huge inequalities in access to COVID-19 vaccines in poor countries. Perhaps many of the pitfalls and shortcomings that evolved during the pandemic might have been prevented if a stronger voice of civil society organizations would have been heard. During my term as a Minister of Health of my country, Argentina, I had the honor to host the G20 Health Working Group under the Argentinian presidency in 2018. At that time, we worked hand in hand with civil society organizations to attach global health priorities and NCD prevention and control, which accounts for more than 70% of the disease burden in low and middle income countries. And we attach NCDs and mental health to the expansion of universal health coverage strategy through primary care expansion. In order to achieve SDG 1, elimination of poverty, and SDG 3, well-being and health, by 2030. At least half the world's population is currently without comprehensive coverage of essential health services, and millions are pushed into extreme poverty each year because of out-of-pocket payments in healthcare. I am convinced, really convinced, that this C20 meeting in India is the right place to keep acting and advocating for a better future in a more equitable world. Thank you very much.
Thank you, Dr. Rubinstein, for those words of wisdom. I would now like to invite Dr. Manoj Nesri. Dr. Nesri is the advisor to the Government of India at the Ministry of Ayush and he advises on policy matters relating to improving the health of people, integrating Ayurveda and other Indian traditional systems of medicine in public healthcare delivery, strengthening and capacity building the infrastructure as well as the human resources of doctors, supporting staff, etc. Dr. Nesri, over to you, sir.
First of all, my pranam to Her Holiness Amma, the Honorable Chief Minister of Haryana, the other dignitaries on the dais, those who are here from various countries, as well as the scholars from India. The theme chosen for the G20 and obviously for the C20, One Earth, One Family, One Future, the Vasudhaiva Kutumbakam. So we are the one family. And in that, when we are talking about the integrated health, the integrative health, and the Ayurveda, which is the traditional system of medicine of India, and it is not only the traditional system of medicine, it is the entire philosophy of life. Because Ayurveda, it is the knowledge of life, it is the entire philosophy of life. And that's why it is not limited only to the medical science or only to the science. And there are many things in Ayurveda which talks about the environment, the eco-friendly, the conservation of the soil, the conservation of the air, the conservation of water, and so many things, because Vasudhaiva Kutumbakam, we are the part of the entire thing. And when we talk about the Vasudha, that is the earth. So earth is not only the human being, but it is also the animals, the plants, the living being and non-living being. And this is actually the meaning of the Vasudhaiva Kutumbakam. This is the actually meaning of the holistic health. When we talk about the health of each and every aspect in the universe, if it is good, we are going to stay good. So if the soil is good, we'll stay healthy. If the air is healthy, we will stay healthy. Ayurveda has given a simile that like the sun and the moon and the air, it is there in the universe. So similarly, the dosha, the vat, pitta and kapha, they are within our body and they actually support our life. But at the same time, what the Swamiji said, that it is not only the body, it is the body, mind and soul. All these three, they come together and that actually becomes the life. So the medicine, what we are talking about in a conventional manner, mostly it is for the body, it is 33%. The 33% is the mind, where actually we need to focus, we need to actually educate the youngsters as well as all the class of the society, irrespective of their social status, economical status, age factor. And that's what actually has been explained in the Bhagavad Gita. And I really appreciate from my bottom of my heart that the Honorable Chief Minister, sir, you have promoted the Kurukshetra on the world map and brought at the international level, because Kurukshetra is the place where the Lord Krishna, he actually advocated the philosophy of life. It is not related to any religion, it is for everyone. And one of the important aspects out of that, which is related to Ayurveda, only one small thing I will quote, it is the Lord Krishna, he tells to Arjuna that Aham Vaishvanaro Bhutva Praninam Deham Ashirtaha Pranapana Samayuktam Pachamyannam Chaturvidam. So that Agni, I myself is present in the body of every being, every living being. And I am responsible for digestion, assimilation, metabolism of whatever the food you consume, whatever the air you take, whatever the intake you have. So entirely I consume, and actually I am responsible for sustaining the life. While being at the new medical school of the Amrita and the new hospital, this particular factor I would like to emphasize over here, that Agni has a great importance in everybody's life, And that is the primary indicator. Whether we are talking about the iron deficiency anemia, the malnutrition, or whether we are talking about the NCDs. So the Agni is the main factor which is responsible for all kind of diseases. Because despite of pumping the iron and folic acid, still today, the iron deficiency anemia in children and adolescent girls, it is almost 50%. So it is not just a supplement which is important, it is also important whether the Agni is there, whether whatever we are providing, the uptake is happening or not. And that is the strength of Ayurveda. There actually the Ministry of Ayush focused that we have to actually improve the Agni of the people. And the various formulations which are there in the Ayurveda, they actually work. We did some kind of the various projects in the public health, and we observed that without supplementing with the iron, with simply the formulation which are based, the herbal formulation like Drakshavaaleha, which is made up of grapes, it is possible to significantly improve the status of hemoglobin in iron deficiency anemia in the children. So whether they are in the Belgaum, whether they are in the Chandrapur, whether they are in the Jamnagar district, so irrespective of the geographical location, it is possible to improve their health status. And likewise, the Agni is there also in the non-communicable diseases, whether it is diabetes, whether it is cardiovascular diseases. And the most importantly, that Agni, when actually we are talking about, it is most important to observe the Agni in the ICU. Because in the intensive care unit, basically we read about the various reports, but then we don't actually look at the what is the actually the digestive capacity, whether the patient is getting hunger, whether he is feeling appetite or not, and getting the appetite, the feeling of the hunger, it is the most important. The Ministry of Ayush is promoting the various aspects of Ayurveda, the various aspects of the Indian traditional medicine, the various aspects of yoga, it is the philosophy. So various aspects of life, whether related to the life, related to the infectious diseases, non-infectious diseases, the Ministry of Ayush is working on that. And as a result, the total sector of the Ayush in the year 2015, it was just $3 billion. But within 5 years, in the November 2021, when we did the second survey, in the second survey we found that the market of Ayurveda, it grows to $18.2 billion. So there is a significant market and it is going in leaps and bounds, and we are very thankful to the Honorable Prime Minister who actually found that, who actually understand the strength of Ayurveda, they understood the strength of the Indian systems of medicine, understood the strength of the Indian philosophy, who promoted the Indian philosophy, Ayurveda and Yoga as the soft power of India at the international level. We'll be very, very happy to work with all the community, with the entire world in the real philosophy of Vasudhaiva Kutumbakam to work for the health of the entire people. Thank you very much. Namaste.
Thank you, Dr. Nesri, and we are very thankful for the tremendous support from the Ministry of Ayush. Thank you, sir. As we come to the end of this wonderful program today, we have some special mementos for our Honorable Chief Minister and the guests on the stage. The memento that we are gifting is actually handcrafted by women in villages in India for our Honorable Chief Minister. And also we have a memento which is a folk art painting of Rishi Sushruta, painted by a tribal woman from Kerala. Rishi Sushruta was an ancient Indian surgeon known for his pioneering operations and techniques and for his influential treatise, Sushruta Samhita, the main source of knowledge about surgery in ancient India. Today, he is known as the father of surgery, and he is a true symbol of integrated holistic health, which is the key theme of this C20 working group. I would like to invite Dr. Jaideep Menon to please come and present Dr. Jaideep Menon, the co-lead of the Integrated Holistic Health Summit, C20, to please come and present the memento to our Honorable Chief Minister, Manohar Lalji. I would like to invite Dr. Sanjeev Singh, Medical Director, Go ahead, sir, please. I would like to invite Dr. Sanjeev Singh Ji, Medical Director, Amrita Hospitals, to present the memento to Shri Krishnalal Gurjar, Union Minister of State, Power and Heavy Industries. Just right, just right. I'd like to invite Swami Nijamritananda Ji, Administrative Director of our hospital, to present the memento to Shri Pavan Jindal Ji. I would like to invite Dr. Prem Nair, Medical Director, Amrita Hospitals, to provide the memento to Shri Ranjit Singh Ji. I would like to invite Dr. Jaideep Menon, co-lead of the IHH Summit, to present the memento to Shri Vijay Nambiar Ji. I'd like to invite Dr. Lekha Vishwanath, Principal School of Nursing, to present the memento to Dr. Agnes Mingwao. I'd like to invite Colonel Dr. B.K. Mishra, Principal School of Medicine, to present the memento to Shri Mulchand Ji, Minister of Transport from Haryana. I'd like to invite Dr. Prem Nair, Medical Director, Amrita Hospitals, to present the memento to Dr. Adolfo Rubenstein from Argentina. Dr. Prem. I'd like to invite Dr. Sanjeev Singh to present the memento to Shri Rajesh Nagarji, MLA from Faridabad. I'd like to invite Dr. Jaideep Menon, co-lead IHH, to present the memento to Shri Narendra Gupta Ji, MLA. And I'd like to invite Dr. Lekha Vishwanath to please present the memento to Srimati Seema Trikha, MLA. We are indeed so honored to have all of us with you here today. Now I would like to invite Dr. Priya Nair to give the formal vote of thanks. Dr. Priya Nair is the co-lead of this Integrated Holistic Health Working Group of the C20. And she's a practicing gastroenterologist. She has completed her bachelor's, master's, fellowship, all from the Amrita School of Medicine. Dr. Priya.
Om Amriteshwari Namaha. It's truly an honor to deliver the vote of thanks for this event today. Coordinating the C20 Integrated Holistic Health activities along with my co-lead, Dr. Jaideep Menon, has immensely given us an opportunity to interact with civil society organizations, experts in the 7 verticals of our working group from over 84 countries. More than 1,000 civil society organizations have registered. And we are truly humbled and inspired at the same time by the incredible work done by millions of civil society organizations fighting all odds and serving their respective communities. At the outset, I would like to offer my humble gratitude to our inspiration and the chair of Civil 20 India, Shri Mata Amritanandamayi Devi, for her vision and her dedicated service of more than 4.5 decades to the world community. This has laid the foundation for the approach we have taken in all integrated holistic health activities during this C20 event. As all of us know, our Honorable Prime Minister, Shri Narendra Modi ji, made G20 a celebration of sorts by involving people from all sectors, all cities, and all civilians who represent our most magnificent India. I would like to thank our Prime Minister for making this an unforgettable experience for all of us. To hold this event in the state of Haryana has been a privilege, a state well known for its progressive thinking and implementation regarding agriculture, industrialization, and above all, the rich art and culture. Just a little glimpse of what we had last evening. All this would have been impossible without the constant, wholehearted support from Shri Manohar Lalji, the Honorable Chief Minister of Haryana. In spite of a very hectic schedule, we are so thrilled you could be here with us today. I would also like to sincerely thank Shri Krishan Palji, the Honorable Union Minister of State, Power and Heavy Industries, for gracing us with his presence. His unwavering support in promoting innovation, skill development, and technology advancements in the power and heavy industry sector is exemplary. Thank you, sir. We are also extremely honored and grateful to Shri Pavan Jindal ji, Sangh Chalak, RSS Haryana, for his august presence and blessings during the event. For all of us to note, he represents the biggest civil society organization in this entire world. So let's have an applause for that. Thank you, sir, for your tireless and unwavering support to society. We are truly honored that Shri Ranjit Singh ji, the Honorable Minister for Power Haryana, Shri Moolchand Sharma ji, Minister for Transport Haryana State, Shri Rajesh Nagar ji, MLA, Shrimati Seema Tirkha, MLA, and Shri Narendra Gupta ji, MLA. They have all taken time from their schedules to join us here on this momentous occasion and bless this event. I would also like to thank both Agnes Binagwaho, former Minister of Health, Rwanda, and Dr. Adolfo Rubenstein, former Minister of Health, Argentina, for sharing the impact of their work with us from their respective countries. They traveled more than 30 hours to be with us, and having an experience with G20 in the past, we really hope that our interactions with them over the next few days will really guide us towards writing a policy. Dr. Manoj Nesari, advisor to the Government of India at Ministry of Ayush, has joined us today to represent the all-important voice of Ayush streams of medicine. The Ayush Ministry has been an endless source of support and guidance. I request Dr. Sanjeev Singh to hand over a memento of our appreciation to Dr. Manoj Nesari. I would like to take a moment to specifically thank the Ministry of Ayush, especially Shri Rajesh Kotecha ji, Secretary, Ministry of Ayush, as well as Dr. Tanuja Nesari, Director of All India Institute, for hand-holding us through this process and being partners with us through this whole forum. My gratitude to Swami Amrita Swarupananda Puri, Troika C20, whose leadership and involvement has added a dimension of confidence and outreach to all of our activities. Thank you so much, Swamiji. Dr. Tedros, the Director General of the World Health Organization, he took time to send us his message. His message for health for G20 health discussions will certainly be a guiding light for all of us through the coming few months. I would also like to acknowledge the relentless efforts of the organizing committee, volunteers, and all the support staff who have worked tirelessly behind the scenes to make this event a memorable one. Your dedication and hard work are truly appreciated. I would also like to express my heartfelt gratitude to all our partners, All India Institute of Ayurveda, Asia Pacific Leaders Malaria Alliance, AIDS Healthcare Foundation, and Mariwala Health Initiative for all their efforts to make this event a success. Furthermore, I extend my heartfelt thanks for the press and the media, and my heartfelt gratitude to the entire Haryana State Police for ensuring easy and smooth functioning of the event. I would like to take this opportunity to thank the members of C20, first and foremost, our Sherpa of C20, Shri Vijay Nambiarji. He is there for every one of our meetings and every single one of our deliberations, and his support is unwavering. I would also like to thank the co-leads, all the coordinators, the International Advisory Committee who's taken their time to be with us here today, and the entire steering committee for all their support and guidance through this process. Last but not at all the least, I would like to thank all of you, representatives of CSOs and NGOs from all over the world, coming here to support a single good cause. Like Swamiji said, we're all here to increase the level of goodness in the world. Your support and enthusiasm will certainly contribute to a meaningful policy write-up at the end of the program. And to conclude, I would like to share our commitment to take the lessons, the ideas, and inspiration and work together in the spirit of collaboration to propel the cause of civil society in the area of integrative holistic health to greater heights as we strive towards a more sustainable and prosperous world that is healthy and peaceful. Om Amriteshwari Namaha.
This concludes this beautiful inaugural event. Many, many thanks to all our dignitaries. Pranams to everybody. Om Amriteshwari Namaha. I would like to request everybody to just remain seated as please let the guests depart from the stage and then we can leave after that. I would like to request all the delegates to go for lunch first, please. Please allow the delegates to go for lunch first, and then the rest of everybody gathered here can join them. Please allow the delegates to please go first.